Hello guys, I'm Sawan from Inspiring Minds, and today we are going to discuss about a very important group of drugs that are called as sympathomimetic drugs, or we can also call them adrenergic agonist. What do you mean by agonist? Agonist means any substance, any drug that binds to this receptor and produces the intrinsic activity. Okay, so what do you mean by adrenergic agonist? Adrenergic agonist means drugs that can bind to the adrenergic receptors. Adrenergic receptor, we know four type of adrenergic receptors: beta 1, beta 2, alpha 1, alpha 2. So those drugs that can bind to this receptor and can produce the effect similar to the norepinephrine, because norepinephrine is the main neurotransmitter that is there in the sympathetic system, okay, that acts on the effector organs. So adrenergic agonists, we have divided them into direct and indirect acting. Okay, what do you mean by direct acting adrenergic agents? It means that if this is the adrenergic receptor, the drug will bind directly to the receptor and will produce the effect. Okay, so which receptor the drug is binding, which receptor the drug is directly binding to? First of all, it can bind to alpha 1 also, it can bind to alpha 2, beta 1, and it can also bind to the beta 2, but it is directly binding to the receptor, so these drugs are called direct acting. Okay, now we'll classify the direct acting drugs into two categories, that is selective and non-selective. Selective drug means they are selectively binding to some receptor. For example, some drug is binding only to the alpha 1 adrenergic receptor out of all four type of adrenergic receptor, so that drug is selective alpha 1. Similarly, the drug can be selective alpha 2 adrenergic, it can be selective beta 1, it can be selective beta 2. So let us take some examples of selective adrenergic drugs. Okay, so we have selective alpha 1, means the drug is only binding to the alpha 1 receptors. Okay, which alpha 1 receptor is so it is binding to the alpha 1 receptor. Which drug is it? The most famous of them is the phenylephrine. Phenylephrine binds to the alpha 1 receptors, and where is the alpha 1 receptor present? Can you please tell me? Yes, it is present in the pupil. Okay, so if we put the phenylephrine in the pupil, it will act on alpha 1 receptor and it will cause what? Dilation of the pupil by acting on the dilator pupillae muscles. Okay, then we'll have selective alpha 2 drug, means it is binding to alpha 2 receptor. Example of that drug is clonidine. Clonidine is a hypertensive drug. It is not the what we say first line of drug for the treatment of hypertension, but yes, it is used for the treatment of hypertension. How we know that the alpha 2 receptor is present on? This is a neuron, yes, and on the presynaptic membrane of the neuron, adrenergic neuron, we have alpha 2 receptor. Yes, the drug binds to the alpha 2 receptor, and this gives inhibitory signal to the sympathetic neuron, and this inhibitory signals causes what? Less release or decreases the release of norepinephrine into the synaptic cleft, and this low level of norepinephrine that is in the synaptic cleft will cause less stimulation of your heart, so it will produce a little amount of bradycardia, or it will reduce your heartbeat, and it will also reduce your diastolic pressure. So this is clonidine that can be used in the treatment of hypertension, but we usually give clonidine when the other hypertensive agents are not very effective. It is not the first line of treatment for the hypertension. Okay, then we have beta 1 selective drug that is only binding to the beta 1 receptor. Yes, we have dopamine, but remember, dopamine is not very typical, what we say, have a little bit of problem, or it have little bit of activity. For example, in low doses dopamine can bind to the beta 1. It is beta 1 selective in low doses, but if you increase the dopamine level in the body, or if you inject the high doses of dopamine in the body, then it is alpha 1 selective also. So alpha 1 selective action will causes what? Will cause the constriction of the blood vessel, the peripheral blood vessels, and the beta 1 effect on the heart. Dopamine, when it will bind to the beta 1 receptor on the heart, it will increase the heart rate. Okay, Then we have the beta 2 selective drugs. Beta 2 selective drugs means that they are binding to the only beta 2 receptor. And where is the beta 2 receptor present? I told you in the last videos, it is present in the smooth muscles of the bronchus. Yes, so salmeterol is a beta 2 selective. You should know salmeterol, it is a beta 2 selective, and it binds to the smooth muscles in your bronchus, causes the dilation of the bronchus, and this dilatation of your bronchus increases the, it eases the movement of the air and can be used in the treatment of asthma and another chronic obstructive pulmonary diseases. Okay, then the other category of direct acting is non-selective. Selective action means that the drug is binding to more than one type of receptor non-selectively. It doesn't have affinity for just one type of receptor, adrenergic receptor, but it can bind to the multiple adrenergic receptors. Okay? So let us take example of beta non-selective. Beta non-selective means it is binding to beta 1 receptor also and beta 2 receptors, or both type of beta receptors, beta adrenergic receptors. So the most famous example of beta adrenergic drug is non-selective beta adrenergic drug is that is binding to beta 1 and beta 2 receptor is epinephrine. And the other brother of epinephrine, the same effect is produced. What is produced by the epinephrine is the isoproterenol. So isoproterenol and the epinephrine action, beta 1 beta 2 adrenergic receptor, non-selective action. Okay, then non-selective alpha. Non-selective alpha means the drug is binding to both alpha 1 and the alpha 2 non-selectively. Okay, means it is binding to both of them. It doesn't have a selective action of one type of alpha receptors. So alpha 1 alpha 2 non-selective drug is again epinephrine. Epinephrine has capacity to bind with alpha 1 receptor also and alpha 2 receptor also. Okay, so epinephrine, beta 1 beta 2 alpha 1 alpha 2, all four type of receptors epinephrine can bind to. And other alpha non-selective drug is your norepinephrine. Preferably it binds to the alpha 1 and alpha 2 receptors at lower doses. Okay, both of them. But if the dose of norepinephrine is increased a lot, then it may also bind to the beta receptors. So it is non-selective alpha 1 alpha 2, but at the considerably lower doses. Okay, then we have indirect acting. So direct acting, we have completed selective, non-selective, and now we are coming to indirect acting adrenergic agonist. Means indirect acting का मतलब क्या है? They are not directly binding to receptor and they are not producing the effect similar to the norepinephrine. So means these drugs are not directly binding to the adrenergic receptor, but somehow they are causing the increase in the level of norepinephrine, or we can say sympathetic neurotransmitter in the synaptic cleft. What are the ways to increase the neurotransmitter norepinephrine in the synaptic cleft? Okay, we'll see. First of all, some drugs are the releasing agents. What does these releasing agents do? If you remember from my last video, the synthesis of the norepinephrine, I have told you that the norepinephrine is packed in the vesicles, yes, synaptic vesicles, and these drugs somehow causes these synaptic vesicles to fuse with the presynaptic membrane of the neuron, and the norepinephrine is released in the synaptic cleft. So indirectly you can say it has increased the level of norepinephrine in the synaptic cleft, and now the adrenergic actions can be produced. Okay, so example of that drug, very famously, I will tell you, indirect acting, a sympathomimetic drug or adrenergic agonist acting in the central nervous system. In the central nervous system, these drugs can increase the level of norepinephrine in all your adrenergic circuits in your brain. So what is the example of releasing agent or a drug that causes fusion of synaptic vesicle to the presynaptic membrane of the neuron and thus increasing the level of norepinephrine is amphetamine. This amphetamine is a releasing agent, means it releases norepinephrine, it causes the release of norepinephrine. So this amphetamine, and the other is the triamine. Okay, amphetamine and the triamine, what are they? They are releasing agent. What are they causing? Increased level of norepinephrine in your brain. Okay, so Remember, whenever the norepinephrine level increases in your brain, what effect does it produce? It causes you to become very attentive, very focused. Your brain is focused, you have good cognitive capacities, and but with a high level can also produce what peripheral effects, side effects. Okay, so in lower level, what amphetamine produces is, that is, increase in the attention, yes, increase in the cognitive capacities, increase learning. This is all produced due to increased norepinephrine in your brain. So this amphetamine was used and is still used as a drug of abuse. Even some students, before they are giving exams, and for example they are in very tough course, and just before the exam they will have amphetamines. This amphetamine will cause increased brain activity, and thus amphetamine will help the student to focus, help the student to learn. So they used to abuse this amphetamines. So you never do it, but many students do it in the colleges. Okay, the abuse of amphetamine to increase the attention. Why the attention is increased? Because the norepinephrine level in your brain increases. Okay, then we have the tyramine. Also, tyramine is not drug of abuse, but tyramine, it is present, it is metabolite of tyrosine. Tyrosine is present mainly in the aged cheese that is aged, or in some wines. Okay, so when you consume it, and you are already taking some drugs that are inhibiting the MAO means monoamine oxidase. So these monoamine oxidase is inhibited in your blood, and thus this tyramine is not metabolized. It is amine, it is monoamine, so it is not metabolized. So increased level of tyramine in your brain produces same effects as the amphetamines can produce in your brain. So be careful that if you are taking some MAO inhibitors, you should never consume cheese and some wines. Okay, because they can increase the level of tyramine. Tyramine can produce central effects, same as amphetamines, and other side effects will be increased heart rate, urinary retention will be there, and other vasoconstriction will be there. So these are the side effects that can also be produced. Then the indirect acting agents are what we call as reuptake inhibitors. What do you mean by reuptake inhibitors? Do you remember the transporter that I called as NET, norepinephrine transporter, that used to transport or reuptake the norepinephrine that is present in the synaptic cleft? So this is synaptic cleft, this is what presynaptic nerve terminal, and this norepinephrine, this marker, is reuptaken into the presynaptic neuron by a special transporter called as NET. So some drugs like cocaine, what does they do? The cocaine, it blocks that transporter. So blocking that transporter, the norepinephrine is not taken up into the neuron, presynaptic neuron back, and thus the level of norepinephrine is indirectly increased in the synaptic cleft. So it is also having some central effects. You sniff the cocaine, and what effect does it produces? Obviously increased level of norepinephrine in your brain. Sympathetic neurotransmitters that is produced due to cocaine is increased attention. Obviously increased attention. The abusers usually abuse cocaine. Why? Because they feel good, they have good mood, they have increased attention, and it gives them the feeling of relaxation. It is anti-stress. Okay, increased level of what we can say adrenergic neurotransmitters in your brain have effect that is anti-stress. So thus it reduces the stress also. But the cocaine should not be taken by you, amphetamine should not be taken by you, and aged cheese with MAO inhibitor should not be taken by you. Okay, so I have discussed them: direct, indirect acting adrenergic agonists. Okay, now I'm going to discuss about some therapeutic agents. What therapeutic agents mean is what sympathetic activity, if I increase sympathetic activity in your body, how does that sympathetic activity can be therapeutically used? I am going to tell you that now. We'll start from the top and we'll move from the bottom. For example, मैं eye से start करूँगा. I'm going to start from the eye. What type of receptor, adrenergic receptor, is present in your eye? You should watch my previous video if you haven't. So what type of adrenergic receptor is present in your eye, and if I give you adrenergic agonist drug that will act on that receptor, so what effect will be produced, and I will see that. Okay, so therapeutic uses. So let's start with your brain because it is at top. So CNS, I've already discussed, but this amphetamines, triamine and the cocaine, these drugs are adrenergic agonist indirect type, but they are not therapeutically used. It is drug of abuse most of the time. But other drug that can be used is modafinil. Modafinil is again increasing the level of norepinephrine and the adrenergic neurotransmitters in your brain. And what does it causes? And obviously it will cause increase in attention, increase in the cognitive capacity, and increase in your learning power. So where can you use modafinil? Modafinil is a drug, and most of the time some herbal agents are available in market and in the pharmacy shops, and these herbal agents, they are be fooling you. They are saying this is plant-based thing and you can eat it, you'll have increased memory, you'll have increased learning power. But most of the time those herbal agents, along with some herbal products, they have modafinil in them, and this modafinil is obviously a drug that can be used for the treatment of ADHD. What is ADHD? ADHD is what? Attention deficit hyperactive disorder. In some students, mostly in the teenage, what happens, they are suffering from the ADHD, and ADHD is marked by they are not able to concentrate on, if they are studying, they won't be able to study even a page for 10 minutes, and they'll be seeing here and there, and obviously they have lack of attention, they are not able to memorize, they are not able to learn. So for helping such students and some people like that, we can use modafinil. Okay, then modafinil can be also used in the treatment of narcolepsy. Narcolepsy means sometimes I have also in my family with some people, what happens with them is that they wake up and they are but they are always drowsy in the morning. For, we can say, if they have they woke up at 7 a.m, they are not able to work till 1 p.m. Why? Because they are sleeping, they are drowsy, not productive at all. So what do you need? You need to increase the level of norepinephrine within their CNS. So again, use modafinil for the treatment of narcolepsy. And for the jet lag, we know when you go in the planes, you are traveling from one country to another, and there is time zone difference, maybe of 6 hours, 7 hours, so your sleep pattern get disturbed, and you just land at airport and you have some work, you have some business meeting, so you can take modafinil and go to the meeting because it will keep you attentive. Yeah, then obviously it can also be used in the case you have low cognitive power, low learning power, and most of the time modafinil is available as OTC, that is over the counter medicine, but avoid taking it. Okay, if you don't just take it because you don't want to memorize anything and you are taking modafinil, it's not good. Okay, just in the case if you are suffering from ADHD, narcolepsy and jet lag. The other drug that is centrally acting and can be used for the treatment of obesity is what? Sibutramine. Why sibutramine can be used in the treatment of obesity? Because we know, remember sympathetic activity, the dog is behind you, what will happen? Will you feel hungry? No. So sympathetic activity in your brain causes what? Anorexia. You don't feel hunger. Okay, same is that the effect that can be achieved by some adrenergic agonist drugs such as sibutramine. These are centrally acting drugs, and this centrally acting drug modifies some circuits in your brain and causes what? Anorexia. You will not feel hungry, and if you will not feel hungry, you will eat less food, and thus your weight is going to be reduced. So sibutramine promotes anorexia and can be used in the treatment of obesity. But do some jogging, do some walking, don't take sibutramine uselessly. Then we have some drugs that will act on the eye. What type of adrenergic receptor is present on the eye? Alpha 1, yes. So alpha 1 agonist, alpha 1 selective agonist in the eye will cause what? Dilation of your pupil. Which drugs can produce dilation of the pupil? By acting on dilator pupillae muscle, having alpha 1 adrenergic receptor is your phenylephrine. So to produce mydriasis and for the retinal examination, you can obviously put phenylephrine drops. Okay, then you have third therapeutic application is in the nasal drops. We'll come to the nose. Okay, nose, we know the vessels that are supplying your nose, the blood vessel, they also have alpha 1 adrenergic receptors. And in the common cold or some flu, what you have is runny nose, nasal congestion, because all the this fluid from your blood vessel is leaking into your nose, and is causing the congestion of your nose and problem in breathing. So we have again alpha 1 agonists that can just constrict the blood vessels in your nose. Yes, and because of constriction of those blood vessels in your nose, you will have less nasal discharge, or those drops are decongestants. Okay, maybe you have used these decongestant drops because they are also over the counter available most of the time. So remember, alpha 1 agonist that can be topically put in the nose, just as a nose drops you can put them. What are they? Xylometazoline and the oxymetazoline. Okay, these are topical nose drops. Oxymetazoline, maybe you know it is available as Otrivin in India. Otrivin, commonly used. Yes. Then for the treatment of nasal congestion, we can also use some drugs that can be orally taken. Okay, example of that drug is pseudoephedrine for the nasal congestion and for minimizing the symptoms of cold. But should it be taken? It is orally taken. It will bind obviously to the alpha 1 receptor in your nose, will produce vasoconstriction in your nose. But alpha 1 receptor is also present in your brain and other blood vessels in your body. So imagine that some child is there and he just drinks whole bottle of the pseudoephedrine. What can happen? It will severely constrict the other blood vessels also, the blood vessels that are going in your brain, and can produce stroke. Yes, you can die if you take very high doses of pseudoephedrine because of this alpha 1 action, because alpha 1 receptor is present in the nose also, but also other parts of the body. So it is having very high risk of stroke. So for the nasal congestion, you should not take pseudoephedrine, but drug of choice should be xylometazoline and the oxymetazoline. Okay, then we have the drugs that are now affecting the heart. Which type of adrenergic receptor is present on heart? Beta 1, and this beta 1 adrenergic receptor will produce what? Increased chronotropic, dromotropic and inotropic action. Increase in the force of contraction of the heart. Okay, increase in the conduction velocity of the impulses in the heart, and obviously it will cumulatively increase the heart rate and the stroke volume. So when you want to raise the blood pressure, or when your heart is failing, or when you have very low blood pressure, so you can use these agents that are acting on your heart. Beta 1 agonist most of the time. Yes, the famous is the epinephrine, I have already told you. Then we have the norepinephrine, norepinephrine. Okay, so epinephrine, if you remember, which receptors can it stimulate? Beta 1, beta 2, alpha 1, alpha 2. So epinephrine stimulating the beta 1 receptor in your heart will produce increased heart rate. It is stimulating the beta 2 receptor in your lungs will produce bronchodilation, so increase airflow, and thus can be used for the treatment of collapsed bronchi. Yes, and also it will act on alpha 1 and alpha 1 पे act करेगी, so it will constrict the peripheral blood vessels and will increase the diastolic blood pressure. So epinephrine is having very much beneficial effects and it is drug of choice in the case of anaphylaxis, anaphylactic shock, because in shock what happens is most of the time the person is or hypersensitivity type 1 reaction, allergy that can produce shock, and in shock what happens is that your blood pressure rapidly falls down, the systolic also and the diastolic pressure also falls down. Along with it, your bronchoconstriction occurs. So epinephrine is drug of choice. It is drug of emergency that is given in the treatment of shock. It will increase the cardiac output, it will increase the diastolic blood pressure, it will increase your breathing power, or it will dilate the bronchus. So drug of choice for the septic shock, anaphylaxis is epinephrine. For the heart failure also you can give what? Epinephrine. Then norepinephrine can be given, but if you see, norepinephrine does not have much effect on heart. It is not stimulating beta 1 and beta 2 receptor. Norepinephrine is mainly stimulating alpha 1 and alpha 2. So by stimulating the alpha 1 receptor, obviously norepinephrine will constrict the blood vessel and will increase the diastolic blood pressure. So in the patients in some emergency condition, the diastolic blood pressure has fallen down, so norepinephrine can be used in that case. Okay. Then we have isoproterenol. Isoproterenol भी अगर आप देखें, so isoproterenol is also beta 1 and beta 2, but it is not having alpha 1 effect. Okay, so it can be used in the treatment of heart failure. Heart is not able to pump, it is in the severe bradycardia, or if your bronchus are constricted because of XYZ any reason, you can use isoproterenol, but it is not the drug of choice for the treatment of anaphylaxis, because in anaphylaxis diastolic pressure is also very much reduced. So the isoproterenol will not have alpha 1 stimulating effect, alpha 1 receptor that are present in your vessel, and won't increase the diastolic pressure that much. So that is why we are using epinephrine as a drug of choice and not your isoproterenol. Okay. Then we have dopamine also. Dopamine, I have already told you that the dopamine is having at low doses beta 1 activity, and at high doses it is having the alpha 1 activity. Okay, but dopamine, you should remember, if you give the patient dopamine in very high doses, it will act on alpha 1 receptor present in the blood vessels, and it can constrict the blood vessels so severely that it can produce ischemia. So your fingers can undergo ischemia and the necrosis. Your bowel, the GIT can undergo, vessel of your GIT will undergo what? Ischemia because of constriction. So it should be used with very carefully. Then I will tell you some other drugs. Obviously, alpha 1 selective drug, that is midodrine, orthostatic hypotension, RX4, which is treatment for orthostatic hypotension. It will act on the alpha 1 receptors in your blood vessel. Do you know what is orthostatic hypotension? That is, you are lying at the bed, your blood pressure is normal, but as soon as you stand up from your bed, your blood pressure will rapidly fall because your peripheral blood vessels are dilated, okay, immediately. So what for the treatment of the orthostatic hypotension, you give midodrine, so that alpha 1 activity of this drug will always cause your peripheral vessels to be constricted and will maintain your diastolic pressure. So midodrine can be used. The other very important group of drug is LABAs and the SABAs. Okay, LABA means long acting beta 2 agonist. Where is the beta 2 receptor present? LABA action is on beta 2 receptor. Where is the beta 2 receptor present? Smooth muscle of your bronchus. So obviously, if you want to dilate your bronchus, you will give your patient what? LABAs, long acting beta 2 agonist, but their action will be for obviously long duration. Example, salmeterol is example, and terbutaline is example. Then the action of SABAs is also short acting beta 2 agonist. The action of the duration, that is bronchus, will be dilated for a short duration of time as compared to the LABAs. So most famous type of SABA, that is short acting beta 2 agonist, is your salbutamol. Okay, we also call this albuterol salbutamol or albuterol. Salbutamol is mostly used in India and in European countries, but the Americans call salbutamol as albuterol. Okay, and we have four no okay terbutaline. Sorry, terbutaline. Sorry. Salbutamol and terbutaline is SABAs, and the LABAs is salmeterol and not terbutaline but formoterol. So let us memorize LABAs, long acting beta 2 agonist. Example: salmeterol, formoterol. For SABAs, salbutamol and terbutaline. So this is the action of adrenergic agonist. For more videos, keep subscribing, liking the channel. Thank you very much.